everything. Okay. All right. So this one is a continuation of what you did before, but the difference is that you are evaluating what your borough is doing. So for this one, we're calling it a health strategies report, and what you're essentially doing is you've already described what the health inequalities in your borough were. So you've said, for example, you've talked about the wider determinants of health in the first report, and then you have reported on the direct determinants of health, which would have been related to nutrition, which is what I asked for. So you might have said that there is a high level of obesity, high prevalence of childhood obesity, there's a low intake of uptake of fruit and vegetables, or low prevalence of physical activity or whatever. So for this one, what you're doing is you're still continuing that theme through, but you're looking to see what the borough is doing about it. So you're evaluating the solutions. Okay, so you're looking for this, you need to consult the JSNA and the Joint and Health Wellbeing Strategy. So you kind of working as a bit of a detective and seeing, is the borough actually prioritizing the things that you thought should have been prioritized? If they're doing so, what are they doing? Okay, what are they doing? And if what they're doing, is that based on evidence? So you need to bring in the literature. It's a little bit more complicated. The first one, you were just fact finding, reporting the incidences, mostly about data collection. For that one, I really wanted to see engagement with Public Health Outcome Framework, which is part of the BDA and AFN requirements. For this one, you're engaging with the two documents, and I don't want anything generic. So students that don't do well on this is when they just copy chunks out of JSNA and they try to put it in their own words, but it's totally generic. And they say, oh, the priorities for this council is A, B, and C. No, I actually want you to relate it. If you've talked about nutrition and diet, if you talked about obesity, then I want you to try and find out what the borough is doing. And whatever they're doing, let's say they're getting their children to run a mile a day or whatever, where does the evidence for that come from? So is that based on evidence? What does the literature say? Not your personal view, but the peer review, the wider literature. So you are commenting, you're evaluating the functions of what the borough is doing in relation to the problems. If you've said that they're not consuming 5 a day, are there any health promotion activities, the things that we've talked about? And let's say they're giving away free fruits in their schools, or they're doing cooking demonstrations to teach children what fruits look like, how do we cook with them. So, and then is that based on evidence? So essentially that's what you're doing. You're discussing what the problems, you've already said what the problems were. Here you're just taking it through and you're talking about what the solutions are and whether those solutions are based on evidence. Essentially, are they effective? And if you find that they're not, you can't find anything, that they're not actually taking any action, then I want you to come up with what you think they should be doing. So again, you have to refer to the literature. So if there's a high level of obesity in your borough, there's a high level of diabetes type 2, which you've already reported upon, well, what should the council then be doing? How would they then treat their population, their community? What does the literature say? So there's different ways of doing this, actually writing this report. One is by critiquing what's already happening, or actually coming up with your own, doing your own literature review on this topic and saying what they should be. But the recommendations can go whichever way you do it. So I'm still expecting some recommendations. Yes?
What I was wondering is, if we've noticed that the borough seems to be doing well in one area,
talk about why.
Yeah, can go through the local area to see if they're strong on
exactly.
an area.
Exactly. And so one of the that's a very good point. And one of the other reasons why I said to you compare to a neighbouring borough, compare to London, because then you can see, for example, one borough, your neighbouring borough is doing so much better. Look and see what they're doing, because then you can say, well, this borough is just next door. They have a very similar population profile, so they could adopt a similar strategy. So it's really, this one is all about the strategies. The first one was about population, about data, about the reporting of the problems. This one is about the strategies. What strategies? And please don't put anything generic, because you won't get a good mark. So when you go on the joint and health wellbeing strategy, it'll say we've got the 5 top priorities. Number 1 is this, number 2 is this. No. What you want to do is actually really look and see what are the actual strategies that they're having. They're having a high level of obesity. What are they doing about it? They've got high levels of diabetes type 2. What is it that they're doing? Is that based on evidence? Is it working? Is it not working? So essentially that is what you're doing. So you're utilizing both the joint strategic needs assessment and the joint and health wellbeing strategy to see what is happening. You can refer to previous ones, you can refer to ones that you've got, sometimes they do one that's for the future, but it's their ideas. You can still use those as well. And then consult the literature. Does that make sense? Yeah? So this one is a little bit harder. It's a bit like doing the discussion in a scientific report. So it's the reasoning. You're really sort of having the arguments. This is working, this isn't working, this is what they should be doing, this is not what they're doing. And what does the literature say? Yeah?
And literature do you mean NICE guidelines as well?
NICE guidelines, WHO, but obviously peer reviewed is, yeah. So I think I've broken it down as well. So I've said, so there's no fixed or rigid format for this report. But I've said discuss and analyze the JSNA and the Joint and Health Wellbeing Strategy. Consider the following. Does the JSNA identify key priority outcomes related to nutrition? Consider community or patient experience, local needs, preferences. Are there any risk assessments? What are the national priorities? Other guidance such as NICE guidelines? Have they actually, like if they're doing weight management classes, is that based on NICE guidelines? If they're doing diabetes type 2, is that based on, are they looking at what SACN is recommending? Outline and describe the strategies or policies which are being delivered. What is the rationale for those strategies? So this is where you need to bring the literature. What is the rationale for the strategies that they have? Yes?
So in terms of like deprivation, it's only direct determinants?
You can talk about the wider determinants, how they're tackling wider determinants, yeah. Because that will also kind of fit in with the direct determinants, but it should mostly be based on nutrition-related problems.
But
the direct.
That's a heavy one that kind of really does affect.
Yes, absolutely. So it might not be something that you can leave alone, and you have to bring it in. Yeah, absolutely.
Okay.
Yeah. Are the policies wide-ranging? Do they include food retailers, outlets, schools, the built environment, the media, healthcare? So you might find that in your borough they have got a policy where children can't buy certain foods at certain times. There will be some local strategies happening, and there are plenty that will help to improve the health of that particular population. Yeah, for example, when we did the NHS health checks, we started in Islington, so that was one method of trying to reduce cardiovascular disease. So there will be other initiatives that are quite localized. Yeah. Yes.
Could aspects like the London Underground not allowing the food industry to advertise, but other in England they are, and that's a strategy within
exactly, yes. So that could be something that could be promoted. Also the national ones like the NHS health checks, those are national guidelines, they're mandated programs. So you can definitely look at what's happening across the country. So you have a lot to talk about. A lot to include. And then I've said, so to think about who your target population is. For example, if it's only children, if you've only talked about children, then what are they doing for children? If you're looking at the adult population, if you're looking at a particular ethnicity. Also, the other thing that is used quite good, where students do really well on, is where they've looked at the borough as separated wards. Because you might have a borough that does really well in one, it's very wealthy, but then there will be wards which are really deprived, and there could be specific programs that are being conducted in those particular wards. Like there could be primary schools within certain areas that have some health programs going on, like extra cooking sessions, food demonstrations.
Or more affluent wards.
Pardon?
Sorry, what was that again?
In the so every borough is made up of different wards. Yeah. So when you're looking at percentages of data, it can be a bit misleading. So you might find that, for example, they've got lower levels of like Hackney might have lower levels of obesity compared to their neighbouring borough. But when you look at the different wards that make up Hackney, there will be areas, pockets there that may be more deprived, may have higher levels of a particular nutrition-related problem, which you can then focus on. And those areas will have targeted strategies. So you can also look at it from that perspective. So you can either look at it, as a whole, or you can actually delve down to the different wards as well and see what's happening. You're looking confused. Are you okay?
No, that's just my thinking.
All right, yeah. Okay. So what is the target population? Does the policy have set targets? E.g., have they looked at a fall in obesity prevalence by a particular year? Look at what their targets are, or an increase in the intake of fruits and vegetables. That could be their targets. Comment on whether an evaluation of progress has been considered. So this will help you, but it's difficult to find. So some boroughs will have actually done some evaluation on their strategies, but you may not find it in the JSNA or in the Joint and Health Wellbeing Strategy. But you can find it if you do a standalone search. If you use your Google search engine to put, for example, evaluation on NHS health checks in Islington, evaluation on diabetes screening in Tower Hamlets. So you may find, and that will be another really good thing to comment on, whether any of the health promotions have actually been evaluated and what was the finding of the evaluation. That will give you a lot of ideas for the for this particular report. So evaluate the content of the policy and perhaps compare its strengths and weaknesses. This is another way you can evaluate. So you can talk about what those strategies are and what are the limitations of those strategies and what are the strengths. So every strategy will have, every health promotion will have strengths, but it will also have limitations, just like the ones sort of we've been looking at today. Some of them have worked, some of them were really effective, some of them may not be culturally appropriate. So think about those things. And again, you can get ideas from the literature. Also, when you're looking at recommending what they should be doing, also don't just look at what is happening in the UK. There are some fantastic strategies, public health strategies in Canada. So search a bit further and bring those, look at what interventions are taking place a little bit further than the UK. So maybe in Canada, in the USA, they've got lots of public health interventions. Look at Japan, for example. It's quite interesting to bring that in as well.
What's that measurement program that
child measurement program?
No, the one that was in Japan.
The Tabo. Yeah, it's called Metabo. So so that's what they do in Japan, where they basically measure the employees. Yeah, it's one of the. I think it is law. I think it's law. I think it is law. Yeah. So you can look it up.
There's a program on, I think it's Channel 4 called Around the World in 80 Ways.
Yes.
And the first episode is based in Japan.
Yeah. Really?
And they go around talking to different companies and they join in with the morning exercise with everyone. And they see employees getting measured and they're like, you do this? Like, as a stand? They're like, yeah. Because it's on the onus of the corporations to ensure their employees have everything to support themselves getting healthy.
Targeting individuals that need help, they work with them directly.
They went from 50% overweight obesity to 4%. They completely turned everything around.
Here they're promoting like health and wellness within companies, but then they're not measuring it. So
No.
then they're you don't have anything to measure.
We've got some students who are doing work like that, but it ends up just sort of showing fruits and vegetables, and it's very.
I think the Japanese are just quite. They're not shy of measuring people.
Exactly.
Because they promote health as part of their culture. Whereas we're very shy. They don't measure men when it comes to pregnancy. Men aren't even considered of whether this is good for the child. It's just the woman. The woman's not tracked properly. Because we're like, oh no, we don't want to measure weight. It's not okay.
a question. If we have involve any more data, like we have the tables, are we including the new tables in that?
You don't need to include the data anymore.
Okay.
But what you can say
because
is
we might miss something, something new come up.
Oh yeah, something new has come up. Yeah,
and it's not in the data from the first report.
Yes,
That's
of
why we
course.
say, should we update that as well?
Well, you can add it if you wanted to. So you can say, the JSNA suggests that there has been a rising level of whatever. So you can add to it, but you can't actually go. You need to go back.
What I mean is doing the proper tables, like the data which is not included in the first report, or do as an appendix maybe.
Yeah, you can definitely put it in the appendix.
So it's like a little bit because we're so much involved in one area, so we have to be very limited.
That's true.
And that one is as well. It's only 1,200 words.
Yes.
It's quite as well limited if you want to actually explain the matter instead of wasting the space for this little information tables that take quite.
Oh yeah, absolutely. Put it in the appendix.
Yes, if it's like few information is more additional, which
you've come across.
wouldn't involve include in the first tables.
Yes, absolutely. Yeah.
We had to, we couldn't. Not enough.
For sure. Yes, we can. Yeah, tables can go in the appendix. So, what else should I be telling you? So, if possible, access any impact or effectiveness of the policy, and if there is evidence of outcomes from the policy, e.g., a fall in obesity prevalence, a reduction in mean BMI, an increase in the consumption. So, you're looking at some measurable outcomes. If they had a health promotion program, did they actually have measurable outcomes? Were they able to see a fall or a rise in a particular event? Discuss whether the joint and health wellbeing strategy meets the population health needs directly related to nutrition. Identify and write about any potential gaps. So what are the gaps? Identify any further evidence from the literature to support the selected strategy. And then finally, it's really what your own recommendations and comments are, so you can recommend other strategies, but this has to be based on evidence. So it's not personal opinion. It's all kind of bring in the literature, and students that do really well are the ones that have actually done the bit of the wider reading. Okay, so avoid copying, because the JSNA and the Joint and Health Wellbeing Strategy has actually done it for you. But please don't just copy. So add your own thoughts to it. Okay. Shouldn't be that difficult because you've done, you already know a lot about your borough. It's now just looking at a few strategies. You only have 1,200 words, so you can't talk about all the strategies. But choose the ones that you think are most relevant.
To structure it, introduction based on your previous reports, and then discussion.
Yes, so you can do it the same way. So you can put introduction. I think I might have put a.
Example, I think.
Yeah, so I've actually put.
Is there an example?
And I've put subheadings. So I've said analysis of the JSNA and Joint and Health Wellbeing Strategy, and then recommendations and final comments. There isn't much, but you can have an introduction, then analysis, and then recommendations.
Okay.
Yeah.
Thank you.
You're welcome. Yes.
I'm just wondering, is that an example of a good piece of coursework that we can
Yeah, I think I have put examples, but I will show you again. I can't. I'll see if I can. It's just that
it's only for assignment 1, nothing from assignment 2.
I think these ones relate to both, but I'll find one because it used to be different. So I don't have one that's exactly the same. But I'll fish one out and I'll show you. I'll share it with you. All right. Thank you, everyone.
Thank you.
Have a lovely break.
Happy Easter.
Happy Easter to you all. Have a lovely